So, Dr. Ra, thank you very much for being here today with us. Today, I believe we're having a conversation that carries real value. We often talk about pain, health, mental health, stress, resilience. These are something that we deal with regularly on a daily basis. But I'm very glad that today we have somebody that who sits at the intersection of all of this, so you could guide us with your story and tell us about the journey that you have been through. But before I go on any further, for our viewers out there, I would like to review your affiliations because they are significant, and I would like to go through them. So, you are a physician, a chronic pain specialist, a lecturer at University of Toronto, assessor of College of Physicians and Surgeons of Ontario. You have founded the Toronto Polyclinic, which has served over thousands of patients in many, many years. Author of Mind, Body, Temple, a book that has opened my own eyes, at least, to understanding how pain management is dealt with. But something significantly has caught my attention while I was reviewing your affiliation, and that is the King Charles III Coronation Medal. It's a very honorable recognition, and I would like to ask you what that represents to you and what does that mean to you?
Thank you for having me today here. I really appreciate this opportunity to talk about aspects of healing that we usually don't have enough time in our doctor-patient encounters to deal with and explain. I agree that I've been blessed with many recognitions through my journey as a physician and as an educator. Like in 2008, I received the Award of Excellence from College of Family Physicians of Canada, the Ontario branch, and 2013 I received the Award of Excellence from University of Toronto, and 2014 I received the letter of recognition on behalf of Prime Minister of Canada, and recently in 2025 I received the King Charles III Coronation Award. This is an award that is recognizing the history of coronation in 2023 and is given to Commonwealth citizens because of their activities in their community or to their profession and to their country. And I was blessed to be recognized with this award. And this is because of my lifelong passion as a physician and as an educator, because to me, being a doctor is to have a degree. Being a physician is to have a profession, but being a conduit for healing of others is a passion, is a reason, is a purpose, and that's the purpose of my life. And through my years of activities, I've been, blessed to be recognized for non-stop, ongoing activity that I've done in educating patients, in the field of educating patients to deal with their conditions and how to deal with chronic conditions. And it's my blessing to be in this journey, and I'm happy to be here today.
Okay, that sounds fascinating. But you just mentioned that through the journey of serving many patients over the years, you are a physician and a chronic pain specialist. Now that brings me to one very fundamental question. That is, what is chronic pain? I mean, I believe there's a textbook definition, and there may be a human definition. I would like to understand the human definition. What are the signs and symptoms of chronic pain? So how does that framed for you?
Yeah, as you mentioned, we have served probably more than 35,000 patients over the past 2 decades in our center. But what qualifies me above all, all the education and years of practice, is that I'm a pain patient myself. So being a patient gives me a different perspective than just being a doctor. So I've seen both sides of the table. So when I say what chronic pain is, it's definitely not the textbook explanation of it. Chronic pain, I call chronic pain humans' unseen enemy, because chronic patients usually suffer in silence and in loneliness. Like if you have a nosebleed, That's a symptom of some medical condition, but everybody will run to your help because they see it. But with chronic pain, they cannot see chronic pain. But nevertheless, chronic pain would affect all aspects of a person's life, from their negative experience of suffering in their life as a personal level, and their effect on their family life, their ability to work, so being a positive member of society, which in many cases defines their identity, and their finances, their whole experience of life from all aspects, from their sleep, their ability to function, their activities of daily living. Every single aspect is affected by chronic pain. And there is a neurophysiological reason for it, because the whole pathway of pain sensation passes through centers that control our emotions, and the whole history of our experience of life are recorded there. And the signals, when they come and pass through that center of our brain, all the feedback of our those memories of from childhood, all the emotional memories, adverse childhood experiences, the sum of all of those feedbacks get to our other parts of our brain. So if it goes to this center controlling our sleep, we can't sleep. If it goes to our emotional parts, we will get depression, anxiety. If it gets to the somatosensory cortex of our brain, we will have pain in an augmented level. So it's like a volume that goes all the way up if that battery of emotional charge is high. So as you see, there are so many factors involved in the experience of pain when it becomes chronic. Chronic pain, by textbook definition, is when the pain sensation or perception of pain passes through the 3 months after the injury. Most of the physiological injuries heal after about 3 months' time. By that time, usually tissue injuries are healed. But if the pain experience continues, then that's considered chronic and has all of these ramifications that I explained to you.
Okay, but you just used the metaphor that I would like to retouch on. The volume, as the volume goes up, life becomes harder as you go by. But I believe that, I would like to understand when is the sign for me that I know, okay, that's enough. The volume has gone up high enough. It is time to start taking an action. Because I think most people may neglect it. They don't know when is the time to take action. So is that the 3 months period? Should I take action before it? Or how do you adjust that volume?
Well, I wish it were that simple that we could put a fine line on it. We should never wait for anything in our healing and our medical conditions improvement. We should always take action as soon as there is an injury. But if I were going to give you just one key point related to the method of managing the condition, that would be activity. We have pain-centered approach to pain management, and we have activity-centered. So if we are focused on pain itself, then, pain is translated into a danger signal, and we don't move, and we lose muscle, and things get worse. That's usually what happens when process of chronic pain ensues. But activity-centered pain management is when we realize that being active will actually help our healing. Now, being active can be active from the knowledge side, acquiring knowledge about how to manage our health and how to advance the healing, or from the physical activities, or from what we eat, or from what we think, and all of those other pillars of health that are important. So activity-centered pain management is the answer, regardless of the time of it.
Speaking of activity-centered healing and management, I would like to take your book into this discussion. Mind, Body, Temple. I've actually personally read the book. I find it very fascinating. It's a very nice book, and I realized through this book, as you speak, you have practically put everything down into words. And I would like to quote something from your book exactly. So I'm going to read it perfectly. In your book, as quoted, working on your physical state will change your state in life. Organizing your mind is organizing your life. So I understand that this book may be very significant to you in terms of how you've framed this journey, but could you elaborate for our viewers what they can find through this book and what it represents to you?
Well, the book is the result of years of suffering from this situation that I don't have enough time to talk to my patients about all the important points that are necessary for their management of pain. For this reason, through my journey as a practitioner in 2003, I set up a website called mypain.ca. So I would recognize that I don't have enough time to talk about all the aspects of physiology of pain and how they can make it better. So I put the material there, and then over years, I worked on developing so many different educational content for patients. So I would give them handouts to take home and read about how to move, how to eat, how to think, all the aspects that are helpful for them, but there's never enough time. So, I thought to myself, why don't I put this into form of a book? And we did the studies in our clinic in 2016. I had a publication about how you can lift the barriers to patient care by providing them with information on digital form. And finally, I put that in the form of a book that would give my own journey history and then share some ideas that can be helpful for them in order to help their mind, in order to improve their body. And the reality is that we make this distinction between mind and body. And these are for us to understand this life form better. But in reality, it's just one life form presented in this universe that is all interconnected. Basically, you are the universe presented in this life form that then we divide it into all different aspects of musculoskeletal system, nervous system, hormonal system, mind, body. It's one life form and it has different presentation. The way we organize it, the better we understand it, and the better the function will be. And the whole concept of mind-body temple comes from the reality that we believe that we own many things in life, but in reality, the only thing that you own is your mind and your body. That's where your life experience happens. So what is more sacred than the only thing that you own and where your life experience happens? The same way that you would keep a place that you contemplate in, whether it's a temple or a mosque or church or synagogue or whatever name you put to that place of sacred contemplation for you, your mind and your body can be that place, and you keep that place clean and orderly, and you organize that, you organize your life. You organize the experience of your life for yourself.
What is interesting is that the metaphor of, well, you framed it as a temple, but given it any name, so it's mind, body in one place. That's how I would like to interpret it for our audience. But I mean, I know you have a broader activity, and for someone hearing what is, they may question what is mind, body, temple. You touched upon it just now, but I would like to ask you to further elaborate, discuss, and deep dive into the concept of mind, body, temple. So your book is also titled as Mind, Body, Temple. So what significance does that bring to you, and what is the message that you would like to framing it as mind, body, temple to get it out there to all the people who are potential patients, chronic suffering from chronic pain and so on?
Yeah, the reason behind using this name and the whole idea behind it is to give patients, first of all, hope. So you know that I have presence in different formats of presenting information to my patients. One of them is a YouTube channel, and every time I start the discussion, I say, welcome to the Mind Body Temple podcast, because it's also put in the podcast form. The purpose of this podcast is to bring hope to patients who are suffering from chronic pain, anxiety, and depression. So everything starts with hope. Now, why patients need hope is that many patients are seeking care, but they don't get better. And we live in an age that accessing information is not difficult. So knowing is not the issue, is the how to put that knowledge into work that is the issue. So it's a methodology of care that is the problem. And I understood this because I became a pain patient myself, and I sought care because I was responsible for thousands of patients' lives. Being the medical director of a large multidisciplinary clinic and having many physicians working with me, and thousands and thousands of patients, as I said, more than 35,000 patients has registered um, with our clinic. And they needed my presence, not a numb person that is using 14 different medications. So I needed to get better without using so many different procedures and medications. So I reviewed all of these humans' history of healing. How did people function under pressure? How would you still be a functioning member of society while you're having all of these impairments? And I realized that activity and disability, these meanings that we put to these words in the society are not very accurate. Like, you have the most brilliant mind of human history in physics who was sitting on a wheelchair, not being able to even move or talk, but nevertheless wrote the most fascinating books of the world. And so who is able and who is disabled? What are the meaning of, the real meaning of ability? So I realized that you need to have a method. You need to have a methodology of using the information that is given to you. That is the reason why many patients, for example, they practice mindfulness meditation for 10, 15 years, but they still have anxiety because they don't go a step by step through a method of care that would put every piece of information, as I said, organized in their mind. And in this mind-body temple methodology, we start with clarity of purpose. Like, people need to know why they want to get better before they learn how to get better. So your why is more important than your how, because the why needs to be clear for you. That will basically harmonize all your vital energy in the journey of healing. And then you get to the point of learning how. So why, clarity about the why in your life, the purpose of life. And the second, these are foundations of this temple. And this temple has, in a metaphoric way, 7 floors, but any structure needs solid foundations. So clarity of purpose is the first level of the foundation. The second is making peace with yourself. Like, when you talk to me, you talk with ultimate, politeness and, your courtesy. But probably when you talk to yourself, you're not giving yourself the same level of credit and respect, which should be among the foundation steps of getting prepared to heal. Once you have clarity about your purpose, and once you put all the inner fire of fighting, inner fight away, and you become calm and peaceful with yourself, then you are ready to learn these skills. At that point, all those knowledge will come to your rescue. But if these floors are not taken care of, all of the skills of the word, all the knowledge of the word will not translate into behavioral change. That is the essence of change.
Okay. You spoke of clarity. I mean, you are saying that in order for that to take place, you need to have a foundation. Let me rephrase it as, if we put activity on one end and disability in one end, the 7 pillars or the interconnecting dots that you just described, I mean, are there to make sure that everything is linked, so that it don't matter the state of your condition, physical condition. If the pillars are connected, you would find your path, your journey to self-management, to healing, to peace. But speaking of those interconnecting links or pillars or the floors that, as you just described it, do you think I could describe those pillars as nutrition, exercise, evidence-based, and I like to emphasize on the fact that it's evidence-based supplements, sleep, mental health, and spirituality? Are those the 7 definitive pillars that interconnect the very 2 ends? Or is there something else? How would you describe those?
So the floors that we talked about was clarity about your purpose, making peace with yourself. Then this third floor is the skills, level of skills, all the skills that's related to mental health, mental and physical health that you can learn And then on the fourth floor, you learn that you have always been in love, but you are taught that you're not enough. So all the anxiety and all those problems with self and society will come to the form. And, the same way that you may not like yourself, your body will start to have all sorts of autoimmune situations that are developed as well. And then, you're on the fifth floor, you realize that all is connected and all is one. So you're, as I said, you're the universe presented in this life form. So you come out of the isolation. On the sixth floor, you just allow yourself to love and like and enjoy life again. And on the seventh floor, that I hope would happen to all of us, you become one with your true, authentic self. You come back. The most important journey of life is not going anywhere, it's to come back to your true, authentic self. So these are the steps of the journey. Now, how do you get to these? Is by a part of it is understanding philosophically about all of these parts of the journey. And the second, there are pillars of health. Like what you eat is the chemistry of the healing is through what you eat. And then how you move, the exercise, the activities is the mobility-centered approach to the pain care that we talked about. So activity-centered, how you move. And the evidence is not just about the supplement, it's about the movement as well. And there's studies related to all of these pillars of health. And then what you eat is important, but what you take as supplements also is very important. And then, other pillars like your mental health, how you sleep, how you connect to the society, and the resilience and spirituality, all of those aspects of healthy living, the lifestyle medicine. Many places like, American College of Lifestyle Medicine have come up with all sorts of guidelines that talk about these pillars. As I said, there's a lot of evidence in literature of medicine that talks about these informations, and this methodology will make those use and put them into work towards the journey of healing.
I totally understand the concept, what you're trying to pursue people to follow, the message that you're working on, trying to get the message out there to people that the very first line of self-care, it's you. You must decide to take an action. But on top of it, and I know this by reviewing your work, you have something as a mission or perhaps a vision. And I think it is something significant and meaningful to you. You have a responsibility framework, and I believe you have named it as Grow to Help, Help to Grow. I understand the concept, but I would like to hear it from your side. I believe it has so much depth. It's simple, but with so much depth involved. What is Grow to Help and Help to Grow, and what is the ambition here?
Yeah, it's interesting because I saw this Grow to Help, Help to Grow when I was in the third year of medical school, and it stayed with me all along. Like all my life, that became a motto that is driving all my activities. And then I, as I got more clarity about my own purpose, which is being a conduit for healing, being a member of society that is helping others to heal, I realized that it's true that the foundation of healing is starting with us, clarity of purpose and making peace with self. But in the purpose portion, if you get anybody to write a list of what are the important points of their life, what they cannot live without and what cannot live without experiencing or acquiring, they cannot live this word without having it or experiencing, what are the fundamental core values of them? There's always some mention of others. So you cannot be healed without helping to heal others. If everybody around you is suffering, you cannot heal. But if you help the journey of others towards their healing, you will heal also. And you will become complete by making others complete. So that's a part of everything that we do in any form that any corporation, any activity, any business, any mission that I do. There should be a portion of it that would go to helping others to lift the barriers to their care or lift the barriers to accessing care. Because in our society as a whole, in our world, there's a lot of inequality. And so long there are others that are significantly suffering, we cannot heal the ones that are not having any barrier to care. We need to lift the barrier to care for others in order to have full healing. And that's my core belief. So that's why Grow to Health, Help to Grow is a fundamental part of everything that we do. There's always a portion of it that goes towards either further education or access to care, or free services for populations that do not have enough access to care.
But if I want to frame this in one package, I mean, your ambition is to get the message out there and then increase access or lift the barrier of access to healthcare, perhaps for many underserved communities around the globe. But when I look at it as one picture, Mind Body Temple stands today. I mean, there's a clinic, Toronto Polyclinic, that you have served thousands, more than 35,000 patients over the past several years. You have this fantastic published book. You have many educational and training courses on this concept. As you mentioned earlier, you have an active YouTube channel. You have an active Spotify podcast. So what's next? Where are we going next? What is there to be added to this foundation and framework? What does Mind Body Temple hold for you in near future?
Well, I'm very excited living at this age because we are living at the digital age. And I've also been blessed with having good friends and collaborators from different really high-ranking universities in my area of the world. University of Toronto, which I have affiliation with, McMaster University, Ryerson University, that is now called Toronto Metropolitan University. I have a long history of collaborating with them and developing different programs, generating science and knowledge related to different aspects of care. So now it's the time that we can take all of these concepts, and this is what we have been doing all along, but basically expand the number of patients that can, or users that can access this body of knowledge, but not just the knowledge, but the methodology of care, methodology of healing. And this whole concept of journey of healing is starting from clarity of purpose, the self, and then getting out there, going full circle by coming back to the true self. So it's an interesting concept that would heal self and heal others by contributing to access of care for others who cannot access the care while we are healing ourselves. And, there are billions of people in the world, and if we join forces, a number of us, professionals, health coaches, users all around the world, with the same goal of healing self and healing others, there are no limit to what we can do all along.
Fantastic. But something that I just want to double check and confirm. So in your continuous efforts of developing this broad idea, as you have laid it out in the clinic, the book, the concept, the theory, and the philosophy that you're trying to get it out there, will you in future expand into consumer supplements in segment of brain health and so on? Is that something you are pursuing? Would we see it out there?
Well, brain health is a big part of what we do, even as a pain physician. A big part of what I do is to improve the brain health, because that's where all the processing of our life experience happens. You give a medication to put somebody into anesthesia. The main thing that medication will do is to basically numb the brain so you can do a surgery. So brain health is very important. When you have a healthy brain, you will have less inflammation in your brain and in your body. And how you can achieve that is through all of those pillars of health that we talked about. And one of those pillars is evidence-based supplements. And supplements that would help the health of the brain, help the cognitive function, health, the life experience processing through the brain is also a passion of mine, because that would be one of the tools that is used in that whole mind-body-temple journey.
Okay. Now, I would like to turn our discussion a little prospect of the future. Given today's advanced technology that you have briefly touched upon, access to knowledge is wide and broad today. We have AI and so many technologies developing as we go by. Will Mind Body Temple step into digital segment? Are you planning on digitalizing anything in your framework of Mind Body Temple so that the access is expand to people out there globally who may not be living here in our region specifically?
Yeah, well, we are already there by having, different presentation of our concept in the form of, courses. So we have digital courses that are online, but expanding it is because we are, again, blessed living in Canada, having access to all of these university faculties that are interested. Like, we have a common goal of healing that a lot of doctors believe in, that a lot of professionals, allied healthcare professionals like physiotherapists, psychologists, doctors, nurses, nurse educators, health educators, believe in the concept, and they are coming together to help expanding this message of healing all around the world. And we have also potential users that are interested in different parts of the world that are coming forward, and people that would facilitate all these connections. And it's shaping. When you have I believe that when you have a good goal, people that believe in good will come forward, and then we can together all around the world shape something beautiful that would, as I mentioned, help our own healing and help others to heal.
Okay. I hope everything goes smooth and very well. So as we're approaching the end of our conversation, I would like to ask you to send a message out there for someone who is watching us right now, who is suffering from chronic pain, who may feel hopeless, who feels stuck, whom don't know where to start seeking aid and help. What is your simplest message to them?
First of all, I have to complete what you mentioned, that you hope that everything goes smooth. I don't think everything will go smooth, because difficulty is a part of reality of life. It's going to be not easy, but it's going to be beautiful to be in this journey. And growth only happens through difficulty. So that difficulty that we are going to face will teach us how to make ourselves better and how to make the program better. As far as the message for the listeners or the people that will watch this discussion, I've all along had one message, and that message of hope. They need to know that there is hope. That's the element of invigorating the life energy for going forward and heal. There are, enough people all around the world that would care about them, and they need to know that there are physicians, there are professionals, there are nurse educators, there are all sorts of professionals that care about them. They're never alone. And it's not selfish for them to want to get better. A good analogy that I always use is that when you sit in an airplane, they always tell you if the pressure changes, you first put your mask on yourself, then put on your child. Although the child is the most important part of your life. But if you do not save yourself, you cannot save anybody else. So it's responsible to work towards saving yourself.
So,
and care for yourself. So it's important. Have hope, and then work towards healing.
So half hope, the other 50% is working on yourself based on the very foundations that you have just laid on. But simply, everything starts when you internally come peace with yourself and decide to take action. Is that how we can frame it?
Find clarity, and there are methods about it. How you find clarity about your purpose. Maybe in another discussion we go through floor by floor and pillar by pillar. But find clarity about why you want to get better. You can tell, oh, I want to get rid of pain, and I can ask you why you want to get rid of pain. Oh, to do things that I cannot do, and I can ask you, why do you want to do them? Layer by layer, I can keep asking till you get to the core reason for your real, authentic values. And that's where you will get energy to get up every day. And that will help you to move, because it's going to be a journey. Any journey needs energy. So you need, clarity of your mind about why you want to get better, and you need energy to move forward. And then making peace with yourself will give you that energy to go. You know the direction, you'll have the energy. At that point, you'll start to learn the skills. And we are here to teach the skills.
I mean, I always look very forward to your discussions, and I hope this work and interviews that we have would continue on and touching on several other topics in the future. But I mean, just to summarize it has, well, first of all, for me, it has been a fascinating discussion. I'm always enlightened to hear your thoughts when you share your journey in the most emotional, human possible way. But I would like to thank you for taking out the time today to be here with us, sharing your passion, your journey, what's coming up next for Mind Body Temple. So thank you again. Would you like to say anything to close our discussion until we meet next time for another session and another recording?
Thank you for the opportunity. I get excited talking about these as well every time, because it's my purpose, as I said, to be a conduit for healing self and others. And through this journey, hopefully we can all work towards healing and then elevating our lives. And that's the whole purpose. And one day we can all come back to our authentic self and unlearn a lot of unnecessary and harmful things that we have learned through life in society, and then become one community of healing all around the world.
Okay, that sounds great. I mean, I think we could end the conversation today, and until the next time we meet and discuss further topics. Thank you so much.
Thank you.